So, hello, today we will look at COPD and we will look at rehabilitation. We know that COPD patients are struggling with getting air, and we can help these patients by a lung rehabilitation program. And this is called pulmonary rehabilitation. Pulmonary stands for lungs. So, the benefits of pulmonary rehabilitation are many. We have, for example, improved survival. The improved survival will be seen in most patients who have COPD and goes into a rehabilitation program. And this is very, 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 very important, because we will expand the years that the patient can live. And we will not only expand the years, but the quality of the years also. Improved exercise capacity. Here comes the quality part. These patients can exercise longer. They don't get air as normal people, but they get it better after this rehabilitation program. And this is very, very important, because these patients usually complain about difficulty breathing while walking, while running. And if you're doing this rehabilitation, it will be easier for them and the complaints will be less. Improved lung function. So the lung will function better. It will be stronger. You will have a strong, nice lung with rehabilitation programs. Reduce hospitalization. This is very important. It's costly, and the patient can instead stay at home with friends, families, instead of being in the hospitals. This is very important. So please reduce the hospitalizations, reduce the days that the patient spends in the hospital. Improve the recovery after hospitalization. So when the patient goes out from the hospital, the recovery is much, much better. Reduced anxiety and depression. This is very typical in COPD patients, because they have difficulty breathing and they get depressed, and the anxiety is there. And we will reduce that by this exercise. Enhanced effect of long-acting bronchodilators. We know we have LABAs and LAMAs. This have been dealt in other videos. LABAs standing for long-acting beta agonist, and LAMA standing for long-acting muscarinic antagonist. And these inhaler devices that we usually give to patients are very good. They are very good for COPD patients, and we will enhance this effect by pulmonary rehabilitation. And why did I choose pictures here? We have a spider and a llama. This is just for you to remember it. The spider will stand for LABA. LABA. There exists actually a spider called LABA. And we have our llama. There exists an animal called llama. And therefore you will remember it, okay? So these are the points, these are the benefits that we have. As we see, we had increased lung function, increased exercise capacity, increased survival, we have less hospital stay, less days, and the anxiety and depression are getting better, it's less. And after the hospital, the patient feels better, and the effect of these inhalers, LABAs and LAMAs, are increased. So the indication of giving pulmonary rehabilitation is actually for almost all COPD patients, especially B, C, and D. We can divide patients into 4 groups mainly, A, B, C, D, and we can say for A patients it's not really necessary, but for B, C, D it's necessary, and it's actually pretty good. This classification system is just in summary telling us how much symptoms and how much risk do we have. If we look at the left side, we have C and A. C and A stands for less symptoms. If you look at the D and B, we have more symptoms. So the risk between C and A is that the C is having a high risk of getting COPD exacerbations. Exacerbations mean increased amount of symptoms of COPD, and in A we have low risk. So everything in the bottom here, we have A and B, it's low risk. Everything above there, C and D, high risk for exacerbation. And then you divide into right and left, C and A, low symptoms, D and B, high symptoms. And in these categories of patients, which means everything except A, that is everything except low symptoms and low risk, have to be, or not have to, but it's good to do a pulmonary rehabilitation. So the contraindications of pulmonary rehabilitation, we have to mention them, because not all patients can get this pulmonary rehabilitation. Please be careful with cardiac disease, or heart disease, and especially uncontrolled. So you cannot really control it so good with medications. And severe arthritis and neurologic impairment. So let's look at cardiac disease, just a good picture for you to remember. Severe arthritis, these are joint problems, rheumatic joint problems that usually makes this exercise very difficult. Then we have neurologic impairment also. When you have paralysis, the one limb is not movable or one leg, then of course this pulmonary rehabilitation is hard. But I would say it can be done, but it's a little bit more harder to do. Okay, in these cases, these are contraindications of pulmonary rehabilitation: heart, neurologic ones, and rheumatoid arthritis, for example. Which 3 tests should be done before doing pulmonary rehabilitations? There can be many more tests, but I want to mention 3. Spirometry, diffusing capacity for carbon monoxide, and exercise capacity testing. So spirometry, you see this guy performing a spirometry. He is inhaling and exhaling into a device, and then this machine measures the volume of air that is going in and out from the lungs. Diffusing capacity for carbon monoxide, we see that we have carbon monoxide in the air, air that the lung exhales and inhales, and this can be measured, and we can look at this with this test. Then we have exercise capacity testing. This is almost like spirometry, but instead we are actually doing it during an exercise. So we are getting the patients to exercise, and then we will measure some parameters. We will measure some blood pressure, the oxygen level in the blood, and so on. Okay. So these 3 tests should be done before we start pulmonary rehabilitation, because then we have a base value of this patient before the exercise, and then we can see what happens after this rehabilitation. Does it get better or does it get worse? And why do we do these 3 tests before pulmonary? That's what I'm telling here, because of the comparison before and after. That's the important part here. The 3 exercises that can be done so 3 exercise capacity testing types are 6-minute walk test, shuttle walk test, and cardiopulmonary exercise testing. So 6-minute walk test, you see here. Remember this, the patient walks for 6 minutes. Then we have shuttle walk test. The patient walks like to the right, and then to the left, and then to the right, and we will see why this is important. In cardiopulmonary exercise testing, this is just a device that measures, as we said, oxygen, blood pressure, and so on while you exercise. So it's connected to the computer. So these are the 3 types of exercise capacity testing that we can do. And now we come, how do we perform this 6-minute walk test? The patient will walk now as far as he can for 6 minutes, and then 3 parameters will be measured. Total distance, how long did he walk in meters, or if you're in America, you will measure it in miles, and then oxygen saturation. Or not in miles, in feet or miles. And then oxygen saturation, that means we check with a pulse oximeter how much oxygen do we have in the blood, and then what type of breathing problems does the patient complain about. So if you look at the picture down there, you see the distance walked, you see the pulse oxy showing how much oxygen there is in the blood, and please check the patient. Look at him, look at the symptoms. How does he breathe? Do he have really severe breathing problem? Write it down. This was a 6-minute walk test. The shuttle walk test is that he's walking back and forth, left to right, between 2 cones, for example. And we will start to increase the speed. So progressively we increase the speed. You see? And then we will see at which point does he get really tired? And then we write it down. It was at cone number, 15. He can go back and forth, let's say 15 times before the pulmonary rehabilitation. Then after we do this rehabilitation, we see that he can walk 30 times or 40 times, and then we see that it's improving. the main message is that we want to quantify the patient's symptoms and quantify his exercise capacity. Cardiopulmonary exercise testing, this is actually just a cycle, and this cycle measures how many watts, so how much energy do you produce, how strong are your muscles, how much oxygen and how much blood pressure, and how fast your heart will beat, and so on. And this guy here will write it down on a piece of paper, or everything is done automatically on the computer. The parameters that we're testing by this, as we said, oxygen uptake, carbon dioxide output. The device will measure how much carbon dioxide is getting out. Tidal volume, we will see what that is. That is how much volume is the breathing in and out. Minute ventilation, how much volume in 1 minute is inhaled and exhaled. ECG, we will put some electrodes, so we will check the heart function here. And pulse oximeter, how much oxygen does the patient have in his blood. So oxygen uptake, we see that the oxygen is getting in, how much. Then we look at how much carbon dioxide is going out. Then we look at the tidal volume, as we said, the volume that is inhale, exhale in a normal pattern. When you do an inspiration, that's the big peak that you can see here. Here, this is the big peak. But tidal volume is not inhaling strongly or exhaling strongly. It's the normal way of breathing, and we will measure it. And usually it's around 500 milliliter. Minute ventilation, we just check how much tidal volume do we have, this 500 usually, times how many breaths do we have per minute. And that will then give us the minute volume, because we have, let's say, 500 milliliter of tidal volume times 16 breaths per minute. Then we multiply that, and then we get the bigger number. And that's the volume of air that is inhaled and exhaled during 1 minute. ECG is simple. We will look at the electrodes and all the specific things that we can see in the ECG to rule out any myocardial infarction or rule out any heart problems that is coming up when you exercise. Pulse oximetry is simple. You have COPD. We know that your oxygen level is low. Let's see how much it gets when you exercise. And the goal here is to improve it progressively. We want to get a better value, a better score of oxygen in your blood. So at least how much oxygen saturation is needed while exercising? That is the question now. How much do we need to achieve? Minimum 88%. Please, we need to be above this. That's a good sign. So we put it on the finger, and then if it says that it's more than 88, then it's good. If it starts to get lower than 88, then we can exercise a little bit more. But if it starts to get 85, 82, 80, and so on, we need to stop. Okay, the patient is getting really, really exhausted. There's almost no oxygen in his blood, and this is not good for the brain and not good for all other organs. Okay, so please remember this. These are the parameters that we will look at during this test. And which is the most common endurance training options? We have cycling and walking. This is simple. There exist many sports, but I would say cycling and walking is the easiest to do for all patients, okay? Especially walking. Cycling is good, but balance and so on, okay. Walking, I would say walking, running, and so on is the best option here. For how long should a continuous endurance exercise be done? At least 30 minutes and at 60% of maximum work rate. So if you have a pulse, how do you calculate your pulse? Take 220, for example, minus your age, and that should be the 100% pulse that you should achieve. And if you take 60% of that, that is the level that you should keep. And this is very easy to measure. You just need a watch, for example. There are many watches that can show your pulse. And please be in the range of 60% for 30 minutes each time. Okay? So this guy is happy listening to music. Yeah, he's using this 60%, which is not so hard to do, but it's very important that we have persistence, we keep up the training, and we do it for 30 minutes. When should the pulmonary rehabilitation exercise be stopped? When we have symptoms of severe dyspnea, so severe difficulty breathing. then please stop. When the patient have chest pain, stop again. Lightheadedness, the patient almost falls down. Palpitations, the same again, heart problems, he feels the palpitations. Tachycardia, meaning that beat is more than 100 per minute, and this can be seen on the ECG, and then you have to watch out. And of course, when you exercise, beats will be more than 100 per minute. We are not actually discussing tachycardia more than 100 per minute here. When we are exercising, we said we have 220 minus your age, and that is your 100%. And if you keep the 60% here, then it's good. But if you start to come up to 70, 80, 90, 95, 100%, then it's not good. Please take it easier, okay? You don't need to reach 100% here. Hypotension, the patient, you see this blood pressure, 75/55 is really low. It should be around 100. During exercise, it could be 150, 160. Okay, normally it's 120/80 when you rest. But when you exercise, this will increase drastically. It can go up really high, but that's natural. That's a natural response. That's not dangerous. The dangerous part with high blood pressure is when you have high blood pressure by resting, not by exercising. And the same goes with the pulse. More than 100 beats per minute during rest is severe, but not during exercise. That's normal. Okay. Refractory hypoxemia. That means we have this pulse oximeter, and the oxygen level in the blood is still so low. And it's refractory, means that it's still low, and it's refractory, meaning it is always that. Okay. It comes up always that it is low. It's not just one occasion. It always is low. Okay. And we cannot really do anything about it. That's refractory. We have tried many medications. We have tried many oxygen therapies, and it's refractory. Okay, then we need to stop. Okay, what type of training is good for patients with severe dyspnea? Interval training. That's very good, with high intensity alternated with rest. So interval with high intensity training, very good. Okay, this means we will have a duration here of less than 1 minute. Peak performance, 1 minute. This is very good. This is when we have a patient with high dyspnea, high difficult breathing. We cannot do an exercise for 30 minutes then. Impossible. What do? We don't say, please lay down in the bed and don't do anything. No, we say, come to the gym or come and exercise with me for 1 minute and then take a rest. And then 1 minute and then take a rest. Okay, that's interval training, high intensity. The type of training that is easier for COPD patients to perform is resistance muscle training. Now we come to a patient who cannot even do this 1 minute. The best way now is to do resistance training. And resistance training is actually doing things that you usually do in the gym. Muscle training, resistance training. Not so much cardio, not so much running and cycling and so on. That will also be beneficial if your muscles are getting stronger. And lifting weight can be done with upper or lower extremities, and not only those. Of course, you can do it with your back, with your shoulders and everything. But the most common is, and the most easiest for patients who are not professional weightlifters, is to lift some weight with the legs and arms. Okay, so this can be done by a COPD patient who is 70 years of age, of 80 years of age, no problem. We just need to reduce the weight, and this will be really beneficial because he cannot do these exercises like walking maybe, but not running, and not this interval training. And we will put this patient into this resistance training instead. How often should a pulmonary rehabilitation be done? 3 times weekly. Okay, please do it persistently, not 1 week and then you don't do it for 2 weeks. Every week, 3 times daily. Okay, for at least how many weeks? 12 weeks at least. And then we see before the value, before how was the value, and now we see it after 12 weeks. If we see it's an improvement, it's very good. The patient starts to feel good. Then lifelong exercise. So quick summary. I will go fast through this. Benefits are improved survival, improved exercise capacity, improved lung function. We have reduced hospitalizations and reduced stay in the hospital. We have improved recovery after hospitalization. We have reduced anxiety and depression. We have enhanced the effect of these long-acting bronchodilators like LABA and LAMA. This is the picture showing that, a whole conclusion of that. The indications are category B, C, and D patients. Remember that. Then we have contraindication being uncontrolled heart disease, severe arthritis, and neurologic impairment. Okay? Then we have 3 tests that we can do: spirometry, we can do diffusing capacity for carbon monoxide, and we can do exercise capacity testing. 3 tests before we do pulmonary rehabilitation. The test is there to compare before and after. The 3 exercise capacity testing types is 6-minute walk test, shuttle walk test, and cardiopulmonary exercise testing. And we perform the 6-minute walk test by walking as far as possible, recording 3 parameters, which is distance, oxygen saturation, and difficulty breathing. Distance, oxygen saturation, and difficulty breathing. Then shuttle walk test, patient walks back and forth, progressively increasing the speed, and we count how many times the patient walked, and then we compare that every week. Okay? The cardiopulmonary exercise testing is cycling, measuring all the values that we have, which is automatically connected to the computer, and then it's easy to see it, all the values progressing on a chart, and we can see it every week getting better and better. This is more complex, a little bit more expensive, but these tests are easy to do. Which parameters are tested in this? Oxygen uptake, carbon dioxide output, tidal volume, minute ventilation, ECG, and pulse oximetry. Oxygen uptake, carbon dioxide output, the tidal volume, minute ventilation, so tidal volume times breath per minute. ECG, check the heart function, and pulse oximetry. Please remember, more than 88%. At least how much oxygen saturation is needed? As we said, 88%. So please check that and always keep that level. The most common endurance training option is cycling and walking and so on. The continuous endurance exercise should be done for about 30 minutes with 60% of maximum work rate. Then this patient will be happy and he can do it 3 times a week, as we said. And this rehabilitation needs to be stopped if we see severe dyspnea, if we see chest pain, if we see lightheadedness, any palpitations, tachycardia, which is not only 100 here, it's much more than 60% of the maximum, hypotension, which is a very low blood pressure, and refractory hypoxemia, then it needs to be stopped. Okay? The training that we will do here is interval training if the patient is complaining about severe difficulty breathing. That means high intensity for less than 1 minute. So the intervals are less than 1 minute. The easiest for COPD patients are resistance muscle training, but that is only done when the patient is really severe, okay? Or really, really old and he cannot do it otherwise, okay? And then we get the patient to lift some weights, arms and leg weights and so on. This exercise should be done 3 times weekly, and it should be for at least 12 weeks, a persistence for at least 12 weeks, okay? And now we have the questions for you, and please answer these honestly. If you can answer them, then you are good. Then you don't need to look at this video again. If you cannot, please check the video again, and then you will master pulmonary rehabilitation. So we have the benefits of pulmonary rehabilitation are which ones? And please stop the video and then answer them. I will go on with all questions. Please stop the video so I don't need to wait for your answers, okay? The indications of pulmonary rehabilitation. Please list the indications. Please list the contraindications of pulmonary rehabilitation. Please name the 3 tests that can be done before pulmonary rehabilitation. Please name why we do these tests. Name the 3 exercise capacity testing types. How do we perform 6-minute walk test? How do we perform shuttle walk test? How do we perform a cardiopulmonary exercise testing? Which parameters are tested in this cardiopulmonary exercise testing? At least how much oxygen do we need while we exercise? Which are the most common endurance training options? For how long should a continuous endurance exercise be done? When should pulmonary rehabilitation exercise be stopped? What type of training is good for patients with very severe dyspnea? What duration of interval training is needed to achieve less dyspnea? Which type of training is the easiest for COPD patients to perform? Which are the most common resistance training options? How often should the pulmonary rehabilitation be done? For at least how many weeks should pulmonary rehabilitation be done? Now, that was the question. I will repeat the answers with only pictures now. Okay? Go through the presentation ultra speed. Benefits of pulmonary rehabilitation: improved survival, improved exercise capacity, improved lung function, reduced hospitalizations and days in the hospital, improved recovery after hospitalization, reduced anxiety and depression, enhanced effect of long-acting bronchodilators. Remember this picture. Pause it, memorize it. Which is the indication of pulmonary rehabilitation? B, C, or D patients? Which are the contraindication of rehabilitation? Uncontrolled cardiac disease, severe arthritis, or neurologic impairment. Please take this picture, memorize it. Which 3 tests should be done before pulmonary rehabilitation? Spirometry, diffusing capacity for carbon monoxide, and exercise capacity testing. This is the picture summarizing that. Why do we do these 3 tests? Before and after. Name 3 exercise capacity testing types. We have the 6-minute walk test, we have the shuttle walk test, and we have the cardiopulmonary exercise testing. These are the 3 tests. How do we perform a 6-minute walk test? As you see, we measure the distance, we measure the pulse oxy, the saturation in the blood, and we look at the symptoms, how the patient is breathing. The shuttle walk test is through going back and forth. We have 2 cones, and we count how many times the patient can walk. Okay, and then we measure it before and after. Cardiopulmonary exercise testing, bicycling, which is connected to a computer, and we are measuring many things here. We are measuring oxygen uptake, we are measuring carbon dioxide output, we're measuring the tidal volume, and we are calculating the minute ventilation with tidal volume times breath per minute. We are looking at an ECG, and we analyze the ECG, and pulse oximetry to see how much oxygen we have in the blood during this exercise. And oxygen saturation needs to be more than 88% while we do this. And this is the summary picture showing all these things that we had. The most common endurance training options being cycling and walking. The continuous endurance that we do is for 30 minutes with 60% of maximum rate, and you calculate it by taking 220 minus your age, which is 100%, and please take 60% of that. It should be stopped, this whole exercise thing, when we have severe dyspnea, when we have chest pain, when we have lightheadedness, when we have palpitations, tachycardia, hypotension, and refractory hypoxemia. Okay? These are the things that you need to remember when you need to stop. The training that is good for patients with severe dyspnea is when we have an interval training, which is less than 1 minute. Okay, so the duration of the interval training is less than 1 minute. The types of training is the easiest is resistance training. Please do resistance training with arms, legs, in a gym, with weights, and that is the easiest for COPD patients to do. And we do it 3 times weekly for at least 12 weeks. Thank you for listening, and hopefully you will remember all the stuff which I included here, and I did all this revision so that you will remember it. I don't want you to spend time on a video that you don't understand and that you don't remember. I want you to look at this video once and then know at least 80 or 70 or 80% of the whole content that I made, and therefore I made these 3 revisions so you will never forget it. Okay, thank you very much for listening.